bit about myself. I own Urban Health Group, which is a boutique style concierge for healthcare navigation and mental health support, and is specifically designed to support Black, Indigenous people of color. I also co-own a multicultural group practice, and I have over 15 years of experience in the field of health, human services, and mental health. But I always like to lead with my humanness. My own experiences with loss really informs my work. I lost a lot of family members, both grandmothers by the age of 13, a 41-year-old cousin due to a heart attack, and a host of uncles due to some lifestyle choices, but ultimately health conditions. So I wanted to be the change, and I went, got my master's in social work, and became a medical social worker working in a trauma center. So a lot of my experience comes from working directly with folks in crisis in the emergency department and ICUs. And I witnessed that there was more support needed beyond the hospital walls. And I've been able to support folks through psychotherapy, folks who are dealing with trauma, but day-to-day life issues. I really believe in people and communities. So I'm happy to be here with you all as we talk about sometimes some challenging things, you know, if medical emergencies come up. So for today, we will, I'll provide a little snapshot on why we should be concerned about medical emergencies. There's a lot of information that we're seeing in the news, on social media, and maybe in your own families about what's going on, especially with COVID-19 being a real threat and really impacting folks, you know, care, and Black, Indigenous people of color are becoming hospitalized a lot more frequently. So it is an important conversation to have. But I'm a social worker. I come from a strengths-based perspective. So I always intend to empower folks and discuss solutions. So that is my goal. What I'm not going to do is leave you hanging, make you feel bad, but you may notice your feelings. You may notice some more things after this presentation. And our time together will be interactive. So I will be asking for your feedback. You're totally allowed to keep your camera off. I know how it is nowadays, folks at home, and don't want to invade that, but I am going to ask that you participate together. And I have my team online. Dominique is our head of community. She will be helping me manage the chat. Erica is my executive assistant, and so she just keeps me all together in general. And we have Camila Jimenez, which is our care advisor. So I'll talk a little bit more towards the end about how we are supporting folks through this time. So we'll go over some really brief facts around what folks are experiencing when it comes to medical emergencies, but I want to spend more time on talking about care solutions, things that we can do, and there will be a Q&A at the end. So I want to know who's in the room. I want to know your name, where you're from, your heritage, and what brings you strength. So I'm Leticia. I'm from Richmond, California. Mexican and Black, and I find my strength through prayer and naps, taking naps. And feel free, if you want to open your mic, you can just raise your hand and our host will let you in. I'm trying to see if I could see the chat. So you can add this information in the chat. I want to know who's here. Hi, Christine. Trying to see how I can move my chat box up so I could read. Sorry, I gotta move this, guys. So continue to add this information in the chat. Your name, where you're from, your heritage, and where you find strength. So what is a medical emergency? I think in general, folks have an idea of what it is. I mean, we see it in our communities, the EMS, the ambulance, you hear the sirens. And if you're not the person in the ambulance, you may not think much about it. But I think it's worth a little time to talk about what is an emergency, a medical emergency. According to the National Emergency Medical Services, these 13 things are the most common complaints that bring folks into the emergency room. So a traumatic injury, that can be someone who was on a bike and maybe they had a bike accident or a car accident. It may look like a slip and fall in the house. It could be a cut, like you're cooking and you accidentally cut a little too deep, or maybe you're doing housework and pruning and trimming the trees or pruning your roses, and you accidentally cut yourself. So traumatic injuries are the leading cause that brings folks into the emergency room. The second is pain. So abdominal pains and problems. My stomach's been hurting for a long time. Respiratory issues, difficulty breathing. So you finding yourself short of breath, or it's hard to catch your breath, or you may notice that it's taking more energy for you to do normal tasks like get to the restroom. Chest pain, I've been noticing you having discomfort. It's really hard to move. You may be restricted in some areas. And the fifth one is behavior or psychiatric disorders. We don't talk about that. There's a lot of stigma around folks needing mental health support. So sometimes it's not into a crisis. Maybe someone drinks too much or takes pills or, does some cutting or some reckless behavior, but it's intentional. So psychiatric mental health needs. And you'll see the list that goes along here. I can even think about for myself, 2 years ago, I had a migraine, a 10 out of 10 headache that was really debilitating. And I found myself, I was on vacation actually in New York, needing to go to the emergency department at 2 a.m. So it's not always, poisoning or a seizure. It can be, I have a head pain that feels like no other pain I've ever experienced before. For the folks who are in the chat, including my staff, have you ever had to go to the emergency room? Let's say in the last 5 years. You can just put that in the chat. Or if it wasn't you, maybe a loved one, a friend, maybe a parent.
Anything.
I think you can open your mic, or if there's someone already in there. Yeah. Your aunt. So it's something that happens to a lot of people. We don't always discuss it. Maybe you're feeling overwhelmed, but folks are going to the hospital and not just routine appointments, but needing emergency care. Thanks, Dominique. So I've only been to emergency rooms. Sometimes that's the primary way that people are seeking medical attention. Some really quick facts. I know the CDC is giving out a lot of information. Maybe on social media you see some things, or if you're listening to the radio or ads, you're hearing how COVID-19 is greatly impacting Black, Indigenous people of color. That means is we are going to the hospital and being hospitalized at greater rates than white folks. And when a person requires hospitalization, like we need to do some more supports, we need to try more treatments, the outcomes are more severe for Black, Indigenous people of color than it has been for whites. So some fast facts are Asian Americans are 80% more likely to be diagnosed with an end-stage renal disease, and that's our kidneys functioning. Women are more likely to have multiple medical diagnoses than men. So it may look like high blood pressure and diabetes. It may look like dealing with depression and heart failure. So another thing to note when it comes to hypertension, which is our blood pressure, we're seeing it occur at younger ages for Black people than white people. So that's our 20-year-olds or 30-year-olds, people that look physically healthy are dealing with increased blood pressure. And there's a lot of community good reasons why that is occurring. There was a study in 2017 that showed that suicide was the second leading cause of death among American Native people between the ages of 10 and 34. So there's this myth that young people are healthy, that young people are not in need of medical emergencies, and that's not true. What we know to be true is that there's health concerns that are impacting the Black and Brown Asian communities way more frequently than others. And you'll see in the times of COVID what that looks like. So I did a similar presentation last summer. You'll see the first chart, the numbers. You see the second chart, which are the most recent numbers, that with more time, things have not faded out. It has gotten exponentially more concerning. So I'm not a very patient person to wait for the healthcare systems and the doctors and nurses and politics to come up with the answers. There's things that we're needing to address immediately within our communities. So what I've seen, when folks are prepared for a medical emergency versus not, there's some steps that folks take, and this is from my experience working in the emergency department. There's been times where when a crisis happens, folks are in shock, and family members are seeking information from the medical team, but we're really needing information from the family about how to care for them. Any diagnoses, and folks have not been able to provide reliable information. What that looks like is maybe the doctor's prescribing a medication that someone is allergic to, or they're receiving some type of treatment that goes against their religious practices. And when you're not feeling well, you don't have all that energy necessarily to express those concerns or make your wishes known. Well, I've also seen the opposite, where folks are actually prepared. You call the loved one and they say, well, this, my dad has this, he has this, don't do this, do this. And it gives the provider instruction. It was a much smoother process. The person received the type of care that they wanted and did not receive the care that they did not want. And the doctors really honored their wishes. They actually followed the instructions. So there is a benefit to thinking about these things ahead of time, because in crisis, you're just wanting answers, and sometimes being in shock, you're not able to provide really great information that will be helpful in your care. So I want to do a little quiz with you all. I want to see how prepared you are for a medical emergency. So Erica just dropped a quiz. It's only 7 questions. It's really quick. I want to see how prepared you are for a medical emergency. So take a moment to do that. I wish I had my music playing for you guys. Let's see what I got. And you feel free to leave questions in the chat. Dominique will collect those, and we'll talk a little bit further about that at the end.
That face.
Take a few moments, take that quiz, and if you feel comfortable, dropping that in the chat. So without, putting your score down if you don't feel comfortable, just see, do you feel prepared for a medical emergency? And you can put yes, or kinda, so-so. and our needs change. So sometimes you go from having insurance to not having insurance. So there's some additional things that folks should be mindful of when it comes to the unique experience of Black, Indigenous people of color, that there is a history of mistrust and neglect. And I call it medical trauma. Folks who have not been treated fairly or even humanely. And I can speak from personal experience of witnessing my family, the frustration of being informed of all care options and having to sometimes feel like fight with the medical team. But it goes, even if you've never experienced it, there are groups that have been harmed by the healthcare system. So we look at the history of enslaved women who were, treated, given surgery without anesthesia. We look at the Tuskegee study that gave syphilis to folks and did not offer the treatment when it was available for many years. There was a study looking at medical students and how they treat pain. When it comes to Black folks and white folks, our pain is even treated differently. That there's a myth that Black folks have higher pain tolerance than others, and their pain not being adequately treated. Also, for folks of the LGBT community, that there's not a lot of training on medical providers, so they may experience some discrimination and some discomfort about talking openly about when they need medical attention. This last point is really, really important, that when it comes to money, your socioeconomic status, it does not change health outcomes for Black, Indigenous people of color. That even if you're wealthy, the likelihood of a Black man having a heart attack is greater than a poor white person, just to be honest. And our most recent example is Bernard Tyson, the past president of Kaiser Foundation. He had a heart attack and died in his late 50s, early 60s. So I know you guys probably know these facts. You maybe experienced some of them within your own families, but I want to talk about solutions, things that we can do to prepare ourselves. So when it comes to just overall care tips, people are doing the best they can to take care of themselves. You are the expert of you. Like, no matter what degree anyone has, no one's going to know you better than yourself. And here are some things that we can do to help begin to have these honest conversations about what you're feeling physically and emotionally. We're used to just pushing through, saying, I'm okay, I'm all right. But when you really pay attention, you say, man, I haven't been able to sleep for the past month. Having those really honest conversations, seeking support, let a friend or a family member know. And if you feel like you've exhausted them or they're tired too, seek professional support. We talk about doing yoga and all that, but really developing some restorative care tips. For me, it's naps, like allowing time to go to sleep and also silencing my phone. So I know some folks have some ideas too. So feel free to put that in the chat if you have some self-care activities that you do to take care of yourself. Maybe you could share them with other folks. When it comes to care tips for managing medical needs, how to get your doctor to listen. There's a short amount of time that we have, even in routine appointments, about 15 minutes with your care provider. If you're asking for something and you feel like your doctor's not aligned with you, ask them to document that in your chart, that they are refusing to run a certain test or acknowledge a complaint you have, a physical complaint. Have a backup plan. So this used to work back in the days when you could take someone into your appointments. With COVID-19, there's a lot more precautions about visitors coming in the hospital who don't need help. So this is a greater concern for our loved ones who are monolingual. They really need a care person, their kid to translate for them. They're not allowing that anymore. So making sure you have a tablet or a phone where you could FaceTime with your family member while they're in their visit. all this can be really frustrating. I get it, but I say don't give up because your health is worth it. So you can always look for new providers. When it comes to interfacing with your doctor, making sure you do your own research, come prepared, but most importantly, have a plan. So there's things you can do today or even this week, the essential things you need to do to know in case of a medical emergency. One is locate your closest hospital with the ER. Now I say that because there's urgent care clinics, there's other standalone health facilities. They don't have an emergency room. So locate your closest hospital with an ER. For folks who relocated or maybe you moved, find out where the new one is in your community. Knowing your medical history and communicating that. Whether you've had an old injury, family diagnoses, you want your doctor to know that. Learn your blood type. If you don't know already, send a message to your doctor saying, hey, I know I've done some blood work. What is my blood type? In an emergency, if you needed a blood transfusion or any kind of blood treatment, you want to make sure you're getting the right blood. In the very least, and if you guys want this deck, I can send this to you later. But store the Adviceline number in your phone. If you think there's a concern, call the professional, get some support. And lastly, with Urban Health Group, we have a Plan Well for Care course. So register for our course if you want to set up a plan. So what is this? This is a step-by-step guide to plan for a medical emergency. And it's geared specifically for Black, Indigenous people of color to have the safe space to explore dilemmas that may come up, strategize solutions, but also develop community of how we can be prepared and empowered. It's a 2-week course that helps folks with understanding and tools to make confident decisions in developing your own solid personalized plan. The goal is that you have peace of mind and that your loved ones have peace of mind. So unlike other agencies, they send you through a course and you fill out some paperwork. This is live coaching. I have direct healthcare experience as a medical social worker and as a licensed clinical social worker therapist. I know the emotional impact. So having live coaching and assistance while doing this, you'll learn tools that you can use over time. Like I said, I have folks who are calling me like, I need to update my plan. That's totally appropriate. But you develop your confidence in decision making. And again, I'm not patient when it comes to making sure my people get quality care and the care that they deserve. So with this social distance since COVID time, the concept of community can be sparse at times. So we have a private Facebook group where we can keep ongoing support for one another. And it's part of the plan on how we, part of the course and how we engage with one another. This accountability to one another and support, we will develop that together. There is a digital workbook that we will use throughout the course, but if you need a physical one, then we can arrange that as well. So we're signing up folks for our course to begin next month. And it's for healthy folks. It's for folks with health or mental health diagnoses. It's for aging folks, our parents who, you might be a little concerned about, or our elders who we're for sure concerned about. It's for folks who travel, folks who have relocated. It's for agencies who want to add value to their clients and employees, who want to be empowered and create these personalized plans. So for the folks who have joined in, you get a $50 discount. And if you get a family or friend to register for the same course date, you get an additional $50 off. So you can email us for that code after this course if you're interested in registering. But I think COVID really highlighted the disparities in care. You can see the issues that are coming out with even the rollout of the vaccine. So there's a lot of needs, and this is a solution to making sure you get your needs met. So you can register on the for the course online, or you could just email us and we'll help you set that up. In the chat, they're dropping some information for you too. So we got a few moments. I want to check in with you guys to see if you have any questions that came about as we've gone through this. And you can raise your hand if you want to open your mic or drop it in the chat.
Hey, it's Karina. I just have a comment to make of something that I noticed recently. Going to the doctor, I went to the doctor and told my doctor that I had this concern, and he kind of just blew it off like, oh no, you're fine, let's just do a test. So then I emailed him and I'm like, hey, I'd like to get some blood work done. And he said, okay, when you come in for your physical next month, which I was kind of like, I'm asking for it now, I'm not asking to wait for a month.
Right.
So just want to point out that I have experienced stuff like that.
Yeah, there's these competing priorities of what the healthcare system wants you to do versus what I want you to do. So having those really direct conversations, there's ways that we can be creative on how, if you can't put the, can you just put the order in? Those are the type of conversations that we will have within this course. So thank you for sharing.
Thank you.
And I know this was quick, 30 minutes, but I'm aware that you guys are working folks, and this is just a refresher that, there is a true threat and concern for Black, Indigenous people of color. And there's not a lot of solutions. We are offering a way to help people prepare in the case that it happens, either for yourself or for your family. So when I first started, I started with myself, my friends, my family members, and it's an ongoing conversation, normalizing having these really difficult, stressful conversations, because I have personal experience with like crises coming up. If there are no additional questions, I just want to thank you all for coming, taking a few moments to check in with yourself. If this information is helpful to you, that's awesome. But if there's other people you have in mind, you definitely want to spread the word. And that's how we support one another, is sharing resources and information. And we are positioning ourselves to address the need that there's certain folks who are getting, more impacted. And this is not new. It's only gotten worse. So this is our solution in keeping ourselves safe, happy, and sane as we go through this crisis together. Thank you all for...
There's one more question, Leticia.
Okay. Go ahead. I can't really see it. It's covering. Do you mind reading?
It said, Florio asked, would you say this is a good plan to add to someone's medical directives or wills?
Yes. So the difference between this course and the medical, healthcare directives and wills, they do nothing if the person does not share this information. I have loved ones who have created healthcare directives and they lost it. So it's not helpful if you don't know how to use it when the crisis happens. So we go through the steps of prep even before the person needs to share this information. So it's a great addition if you've already done the medical directives and wills. And that's all we got for you, peoples. Thank you for joining in. We look to have this monthly, so if you missed it and you want to share it for someone else, please spread the word. And if you want to stay connected, here is my contact information, and you could visit our website to learn more about our services. So thank you all.